Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, and integrative medicine and topics thereof, and the informations for the individual, for the society, and the world. So today's topic, I'm going to call it, autism flashback, where we were, where we are, and where we're going. And it was interesting because RFK, Robert F. Kennedy, has brought the topic to the forefront. By September of 2025, there's supposed to be a study or some type of statement of the cause per se of autism. And two things happened. One is I happened to listen to a McCullough report by Dr. Pete McCullough, an epidemiologist, cardiologist, and internist who I followed for all things COVID and some integrative medicine topics. But he gave a talk. I believe it was at the Autism Health Conference. Let me just get the name right. Yeah, Autism Health Summit, A Journey to Wellness, April 11th through 13th, 2025 in San Diego, California. And he was a keynote speaker. And the emphasis of the talk was the determinants of autism spectrum disorder. And before I get into that, because his big push was, let's look for risk factors and not say causes. If we look for risk factors, we'll get more movement forward from everybody than if we just say that's a cause, that's a cause, that's a cause, because that just, he doesn't believe there's one cause, and it tends to get people isolated in their opinions. But just interestingly enough, the website, Autism Speaks website, which I put a little section, a little blurb in here. If you go to their website, it says 1 of 31 uh, uh, children have autism, and that was in 2025, just recently in April. And so I decided to go back because I have been doing this 40 years, and about 21 years ago, in 2004, I went to a conference called Defeat Autism Now uh, by a gentleman who was a psychologist, the organizer, Bernard Rimland. His son, I believe, was autistic, and they talked about nutrients back then, the gut, and Andrew Wakefield popped up, who is I'm going to talk about in a minute here. But that was in 2004, and I remember it was in Los Angeles. And in integrative medicine, we're looking for multifactorial causes. I use the word multifactorial causes or risk factors to contribute to a problem. And so autism is no different. And I remember, I don't know if it was at that conference, but I heard Andrew Wakefield talk, the gastroenterologist, who noted that young people who had this behavioral disorder also had this abnormal lymphoid hyperplasia and abdominal symptoms. And that made perfect sense to many of the functional medicine doctors, but they weren't called functional medicine doctors, and the nutrition oriented doctors, and that the thing that a lot of the behavioral problems start in the gut. But he ended up being ostracized for the last 20 plus years, and he's just kind of come out again. And it's amazing how time flies. So I was at that conference, and I'll tell you the one thing, that Defeat Autism Now conference, it was in October 1 through 3 in 2004. And I remember sitting at tables, and you would see very educated parents, and many times very professional parents. And you'd hear this kind of story, and I've shared it with patients over and over again. They would say, my child was fine. And then they might have a series of illnesses, chronic earaches, sore throats, tonsillitis, chronic infections. And then they got the vaccine, and then boom, changed forever. Behavior, sometimes couldn't speak, sometimes real abnormal behavior. And you would hear this over and over again. And these were people who had resources, and they would go and share their observation that something happened after the vaccine and they would be blown off by, let's say, the neurologist or whoever was the main physician. And I heard that story over and over again. And it was profound, and it was, autistic parents that care for autistic children or any children that have a disability are just heroes and they're warriors. So I remember, looking at diet and lifestyle and heavy metals and gut overgrowth of bacteria and yeast and a lot of those things did and still do help autistic children. So flash forward, and the reason, I've treated some autistic people over the years, but some people, you almost have to orient your whole practice to it because it's a lot of intensive energy and education. And so we didn't choose to do that, though I've treated, probably 10, 20 autistic people over the years. But they usually have sometimes they'll want a specific autistic physician that just does that. So flash forward 2004, 21 years, and I'm listening to Dr. Pete McCullough's April 21st McCullough report, and he wanted to summarize his talk, or actually let us listen to his talk at the Autism Health Conference, a Journey to Wellness, Autism Health Summit, excuse me. And I just want to highlight before I get into that, at that time in 2000, I went back and typed in CDC incidence of autism, and it was 1 in 149. Or, as said another way, it was 6.7 per 1,000. So in 2000, it was 1 out of 149 children would have autism. And then in 2014, it was 1 in 59. And then in 2016, it was 1 in 54. And in 2025, it was 1 in 31, excuse me. So those are CDC numbers. And so people would say, you're just diagnosing better. But most of the people that really study autism don't believe that it's just because we're better at diagnosing. There's something in the environment or what we put in our bodies that goes beyond genetics that is pushing our biochemistry or the biochemistry of these individuals to off or out of balance. And I'll remember one other thing from that conference in 2004. They were just starting to look at organic acids, and organic acids are the metabolites of biochemical pathways in the body that come out in the urine, and they're usually for genetic metabolism disorders. There'll be a distinct pattern. Well, they noticed a distinct pattern in one of the organic acids that related to fungi, and they noticed that sometimes those were elevated in the autistic children. And a typical scenario would be for an autistic child. They were born um, living a good life, and they might have had chronic earaches, sinus infections, sore throats, and then had multiple rounds of antibiotics to treat those situations. They continue to eat a very sugary diet that's got a lot of dairy products, processed wheat products, and this cycle continues of treating the infection, and then with antibiotics, but no probiotics. This is in the early years, and no balanced antifungal program. And so what happens is you start to change the gastrointestinal flora, change the gut permeability, and then you start to develop bigger macromolecules being absorbed, and that triggers your immune system. And that is a history that I've heard over and over and over again. So the testing for organic acids was just started then, and they actually came up with the metabolites for fungi. And used to do a lot of those. I don't do as many of those anymore, but they're still done today. If you would go, somebody got evaluated for a gut issue, but in particular, autistic children. So flash forward to what really struck me is Dr. McCullough. He's an epidemiologist, and he came, and a cardiologist and internist, and he looked at the autism issue through the eyes of an epidemiologist. And what he was trying to say is that instead of coming across as this is a cause or that's a cause, which is going to put people off for several reasons. One, there's no one cause, and two is it's going to get people into camps. But it's better from an epidemiologic point of view to look at autism as an epidemiologic problem and as a consequence of risk factors. And so when you look at that, then you can start to study the risk factors, and that's a little bit easier said than saying that's the cause. So I wanted to go through a few of those because he just put his talk into the podcast. I have a link to the podcast. You all should listen to it. It's absolutely outstanding. But autism's been around at least 80 years. He talks about a Dr. Leo Kanner, Knner, who had 11 cases in 1943. So at least that long. And he actually even mentioned Martin Luther in 1483, described a 12-year-old boy with autism. But we know we have at least an 80-year history of this entity, autism, being around. And so here are some of the risk factors that I think make some sense. So he talked about genetics. It doesn't appear to run in families. So genetics manifests an illness when we have environmental factors that apply to it, but it doesn't seem to be a strong component. Immune dysregulation, absolutely. Inflammatory cytokines can be released that can trigger all kinds of neurologic problems. Environmental, probably some components can aggravate our biochemistry. The microbiome, absolutely. We have more neurotransmitters in our gut than we do in our brain, and our gut is related to absolutely what we put in. The microbiome changes by the fiber we eat, period, or we don't eat. Cellular energy production. If we don't have our mitochondria working right, it's kind of a buzzword now, but mitochondria produce energy in the body and in every cell. So mitochondrial dysfunction. There is possibly a mild relationship to MTHFR, the methylene tetrahydrofolate reductase enzyme that you can measure, and that relates to the metabolism of proteins. And they utilize B6, B12, and folic acid. So sometimes normalization of B12 and B6 and folic acid can sometimes help autistic children. We know preterm delivery is a risk factor. We know that parental age, the older people get, above 40 and above 35, above 40 for males and above 35 for females, increases the risk to autism by almost 50%. As I mentioned, immune dysregulation. Cytokines play a role. Cytokines, again, are inflammatory compounds, and they are associated they're responsible for fever. We know that febrile seizures increases the risk to sudden infant death syndrome, and it also has an association with autism. So a child that has had febrile seizures may have an increased risk to autism, or they're going down that pathway of this accumulation of symptoms. And then, probably one of the biggest is the intensity and frequency and combination of childhood vaccines. So, he finishes his talk, and I'll tell you the numbers because I have to kind of go through them here. But the numbers are maybe the vaccine schedule in 1962. Dr. McCullough was saying he was getting 5 diseases treated with 3 shots. In 2024, the child gets somewhere between 88 and 113 shots, depending if we put the COVID vaccines in there and such. It defies logic that you would give that many combinations of a substance, any substance, a medicine, to a developing human being, especially early on in life. And I can go through each one and question why. Why do you get hepatitis B at birth unless you have a drug addict parent? It just doesn't make any sense. Haemophilus influenza doesn't make any sense. I mean, you can go on and on and on. So probably one of the most key things is that may not be one vaccine, but it may be the combination and load. And vaccine is not just the vaccine, component. It's the biochemicals that go in there, whether it be thimerosal, which was the mercury, or other agents. So the vaccine issue is, in my opinion, one of the biggest because it's been carte blanche done, and it's been increased at a very significant amount. I mean, we can go from, you know, 6 or 9 vaccines when I was younger to 80 plus, 80 to 100. It just doesn't make any sense. And that's where you would have to start. So he talks about it's an excellent article. I mean, an excellent interview. I would highly recommend that you listen to his speech. But it goes through these things, and he calls them risk factors. So when you add up all the risk factors, it could be aluminum, it could be fluoride. We have see children with more peanut allergy, and then you add in the processed, ultra processed foods. The goal is to eat whole foods with all the micronutrients in them in their natural state. So when you eat ultra processed foods, not only do you get stripped of a lot of micronutrients, but you get added things in there to make a difference, whether it be the dye or whether it be whatever. So, you know, one small dye might not cause autism, but when you have this accumulation over years of micronutrients getting taken out, which protect you, which help your metabolism work well, and then more insults thrown in, it's obvious. And one of the biggest things would be to study populations, and he closes with this, would be to study populations, and we've never done this, where they don't get vaccines compared to those who do. The Amish are a group, very hard to find autism in the Amish community. They don't get vaccines. And now we have a period, and he closes, and I'd like to close with this. There's a period of time now where there's enough people that are very skeptical of vaccines who, if given the choice and not forced to because of school, wouldn't get them. And there's enough people who believe in them. We could do a prospective study now, and just look at the difference. Children that get vaccine, children that don't. And we'll see if the powers that be want to do that, because it will be very obvious, I feel, that if you don't get vaccines, a lot of these behavioral issues, whether it be ADHD or whether it be autism, are going to decrease dramatically. And we haven't even talked about pollution from, Wi-Fi and looking at monitors for a long time. So it's worthwhile listening to this. The lesson is still very simple. Eat whole foods. I would personally be cautious. All right, obviously sugars. I always pull people off dairy, wheat, and eggs. If they're eating a lot of eggs, I'd do that for 2 weeks to 4 weeks. And the reason I use dairy is because I've seen it cause more problems than any food there is. So you want to know. And the classic little cheese quesadilla, with a glass of milk and some jam, there you go. So I would eliminate those. I would do some kind of stool exam and or treat the gut. And if they had a strong antibiotic history, probiotics, and I would do an antifungal program to help normalize the gut. Uh, we can get into environmental ones, but that's tough in children. Doing heavy metal screening is tough. Screening for mold is tough for any age group, but that can affect behavior. So you want to start from the inside and work out. Whole food, unprocessed food, do some type of food elimination, treat the gut with probiotics and or maybe an antifungal program if they've had lots and lots and lots of antibiotics. Reduce the load of vaccines. You can stretch out how you get them or don't take them. Try not to have combinations. And I think it's a solvable problem. It really is a solvable problem. And I think that we have a unique opportunity now with RFK as the head of HSS. And a lot of these doctors, it's interesting. So I've been doing this a long time. And a lot of the doctors that are on board now questioning vaccines were very pro-vaccine. whether they were conservative or liberal. These are traditional doctors. These aren't alternative doctors by chance. Dr. Peter McCullough is a very traditional doctor, and I've been around a lot since treating COVID of traditional doctors who are their minds have been opened up because of censorship, because of looking at a way to treat an illness. It was COVID, and with repurposed drugs, et cetera, and then more nutraceuticals and things like that, that opened up their minds to maybe what they've been taught all these years just by dogma and routine may not be true. So a lot of the leaders that are challenging even vaccine dogma are not alternative doctors. These are traditional people. And when you talk to them and you say, would you vaccinate your children now? There's some hesitancy. And Dr. McCullough ends his talk, or in his talk, he talks about the World Health Council and how that's a group of physicians who say, just put vaccines on hold. Okay. So my name's Kirk Hamilton. I hope you got something from this. All these risk factors and determinants are below. We want to reduce our risk factors as much as we can for any immune illness, but especially to help with autism. And we want to treat the gut. We want to eliminate certain foods, get outside and get some exercise. So I hope you get something from this. I think you will. Look at the written summary below, and I'll talk to you soon, and you have a wonderful day.